request Dr. Praveen Vashist to highlight the government initiatives and strategies for achieving effective refractive error coverage. Dr. Praveen.
Thank you, sir. In fact, I've been asked to talk about like effective refractive coverage. In fact, how government can achieve this coverage. Dr. Padma has just mentioned, given the definition of effective refractive coverage. The issue is that at this stage, we are not aware what is the effective refractive error coverage in our country. This is a bigger challenge. As sir has just mentioned, that myopia is an emerging epidemic, and number probably all of us are aware that we are leading towards in 2050 that 50% of the population may be myopic, 50% of Indian population. And beside this presbyopia, we know nearly 60 to 70% of people above 40 years of age, they are already having presbyopia. In fact, Dr. Rohit is there. We have done this meta-analysis. As per this meta-analysis, before COVID, we were finding that the prevalence of myopia refractive among children is nearly 8%. And not only in urban population, it is also increasing in rural populations. That's something very worrying, that in India, the burden of myopia is increasing. In fact, it is estimated at this stage, this is around 20%, 3 times increase in last 20 years. So the estimate that this will be around 50% by 2050, it seems that it may happen. WHO has taken this initiative that to achieve universal health coverage, we need to increase our effective refractive error coverage. By 2030, it is not 40%, it is 40% point. If we have 30 at this stage, then we have to increase to 70. So it is a number, it is point percent, it is not percentage. By percentage, it may remain around 40%, but it is 40%. That need to understand actually. NPCB, we did this National Blindness and Visual Impairment Survey. We could actually calculate the effective cataract surgical coverage, but we were not able to calculate the effective refractive coverage. After that, we have done few studies, and as per those studies, I can tell you the coverage in our country for effective refractive coverage is around 25 to 30% at this stage. In better performing districts, in Gurgaon, we could get up to 60%. But I believe it is not more than 60% in any of the districts of the country. This is assumption at this stage. We are doing, in fact, we plan to do survey. This is the first initiative which Government of India is now taking. That, in fact, today is a meeting in ministry. We plan to do this effective refractive coverage survey in country. It is planned that we'll be doing it in 30 districts. And it will be done in 2 phases. One in 18 plus population, that is for myopia as well as for presbyopia, and other in school going age group to 5 to 17 age group. So these 2 survey will be conducted, and our plan is to actually assess the current status, and in future we plan how we achieve the coverage finally by 2030. So this is first strategy which we are going to implement now. And as we know that even refractive error, by working in hospital alone, we cannot achieve. It is like an iceberg phenomena. The people are in community, so we have to reach to community. The first strategy, which Dr. Madam has just given a detail about this thing, that what is school vision screening program. We feel proud that India was among those countries who started this school vision screening program under the national program way back in 1994. And under this, the spectacles are being provided totally free of cost. It's a low-cost screening program, non-invasive technique, using 6/9 cutoff, where school teachers are screening it, reliable, rapid, and acceptable program. So all criteria of screening are there. It's a 3-pronged program. Stage 1, teachers are being trained, and they do the initial screening using 6/9 cutoff. Then we are referring to ophthalmic technicians. They do the refraction. And finally, it is going to opticians, where they provide spectacles, and that too free of cost. This is 6/9 cutoff. The question is whether 6/9 cutoff is right, or we need to change to 6/12. WHO recommends 6/12. We had a detailed discussion. We wanted that we should take 6/12 cutoff. But the Government of India says If teachers are screening, teachers are non-medical person, then you can use 6 by 9 cutoff. Let them refer more number of children, and the optometric ophthalmic technician, they can screen using 6 by 12 cutoff. That was like reason given by Government of India for using 6 by 9 for school teachers. If an eye care worker is doing, probably it is better to use 6 by 12 cutoff. Numbers. What is the actual number needed? 8%, 10%, what is the amount? This number is for India. Just see, for a population of 140 crore, nearly 25 crore children need to be screened every year. 25 crore. And we need to provide 2 crore spectacles every year. This is such a huge country. And what we are actually getting is our NPCB target at present, we are happy to say that we have increased to 15 lakh. Before that it was 9 lakhs. From 9 lakh is 60% increase. Now the target is 15 lakh. But 15 lakh is it's around 7.5% of the actual population base need in the country. That we need to understand. So time bata dena, main just jaldi khatam karu. So these are the major issues. Yes, but myopia burden is not actually known. What is actual burden? What the frequency of screening? Once in 4 years we recommend as per a national program. But we know it very well. The burden as well as the incidence and prevalence of myopia is so high that we need to screen children every year in the school, not once in 4 years. Of course, the data is not available. We have a regular reporting in NPCB. It is just number of spectacles given to children. What is the prevalence of myopia? What is the cutoff levels, etc.? No data is available with government. So we need to strengthen program. We know it very well that there is need for technology upgrade. We need smartphone apps so that entire data can be collected at one point, and of course it can be shared, and even a feedback can be given at all level. Annual screening, 6 by 12 cutoff, these are the other strategies which are needing. And of course, people have talked about need for quality spectacles and proper delivery of spectacles. This is a need. The third important strategy which is being recommended is the vision center base. You know, we need 50,000 population, we have one vision center. There is need for at least 20,000 vision center in the country. Probably it is the best strategy. We need to go from school base to vision center base, where ophthalmic technician is available. Parents can go and show children, and screening can be conducted. This is another model, and I have shown this presentation so many times. The vision center is the only model by which we can think of achieving universal coverage in the country. Of course, human resource ophthalmic major technicians, it's a major challenge for our country. The various associations say that there are nearly around 70,000 ophthalmic technicians are available in country, but I doubt, as per our data which we collected in HR survey, the number is around 20,000 only. The rest we have to think about how to increase the human resource, infrastructure, manpower. All these are challenges, and we need strategies. Asha worker are one way where we can involve them through health and wellness centers, and they can be involved in initial screening of all the children in entire population for visual impairment. RP center has shown that a medical college, a hospital can achieve. We have even provided more than 600,000 spectacles in last 10 years. So this is an achievement. Probably other hospitals can also do. But probably the best strategy is prevention. Prevention at school level, where we can increase the outdoor activity. We just shown a slide. From 50% we can reduce to 28% if we are using preventive strategy. That means outdoor time is increased in schools, and also if we reduce the near work time for school children. Probably this is one strategy which need to be adopted all over the country. So finally, if you want to select the best strategy, it is the integrated model. All things should be combined together so that we can achieve universal eye health coverage in the country. Thank you very much. Thank you.
Thank you very much, Dr. Praveen.